Hello, I'm Sakir Ahmed, Rheumatologist and Clinical Immunologist, and today I'm here to talk about arthritis. What is arthritis, why it happens, and to whom does arthritis happen to? So, to begin with, the first question for the day is, what is arthritis? Arthritis is swelling of the joint. Now, we should differentiate the joint from the bone. Bone is different tissue which may be affected in later parts of the arthritis, but if you look at the joint has beyond the bones the cartilage, which acts as a shock absorber, and various tissues around the cartilage. So this tissue is called the synovium, and this tissue gets swollen up, leading to arthritis. The next question often asked is, who gets arthritis? And the answer is as simple: anyone and everyone can get arthritis. Arthritis can occur at any stage of life, starting from a child to the very old. Rheumatoid arthritis, a common type of arthritis, usually starts by the age of 20 years and its incidence increases as age goes up. However, even small children can have arthritis, which is known as juvenile arthritis, JIA, and osteoarthritis, which can occur at a later stage of life. So, what are these different types of arthritis? Coming to them, one of the most common across the world is osteoarthritis. Osteoarthritis doesn't have so much of inflammation as other arthritis, but there is damage of the cartilage and there is repurposing, the shape of the underlying bone changes and the joint space is reduced. Thus, the bones can grate against one another, leading to pain and disability. Though classically it has been called arthritis of wear and tear, it is not just only that. Even the overlying muscles, the ligaments, all the tissues which support the joint can get affected in osteoarthritis. Beyond osteoarthritis, there are gamut of inflammatory arthritis. You can see so many of them are there in the list given below, but you need not worry which is which and how to diagnose them. That is the job of your doctor. However, if you have been diagnosed with one of them and you want information about them, please write to me in the comments below and I'll definitely make a video on that. Then, why do we need to know about arthritis? Arthritis not only destroys the joints, it leads to different disabilities as well as deformities. As you can see the pictures here, the hand is misshapen and the joints are so weak the patient may not be able to pick up a spoon, he may not be able to pick up rice. So this is a very important part why we need to treat arthritis, but it is not the only reason why. Arthritis can cause many other problems such as heart attack. Yes, it can cause heart attack and even stroke. Heart attack, as you might be aware of, is the blockage of an artery supplying the heart due to various reasons. Most common of all, due to deposition of cholesterol. In the various inflammatory arthritis you have seen, there is accelerated deposition of cholesterol and thus heart attacks can occur at a very small age before you expect it to occur. Similarly, stroke is when the blood supply to the brain is disrupted either by blockage or due to bleeding inside the substance of the brain. Another quite common complication of arthritis is involvement of the kidney, which is known as nephritis. Now, this can be temporary or even permanent, requiring lifelong dialysis. Another cause is involvement of the nerves or neuritis. Neuritis can lead to numbness, presence of tingling sensations, or even weakness where one limb, one hand or one foot stops to work. These are all complications of arthritis. Similarly, the arthritis can affect other organs like eyes, the skin. You can see the pictures here. There can be multiple dot-like appearances on the skin to very big ulcers. And these are all complications of untreated arthritis. So, we know now that what is arthritis, what are the complications of arthritis, but the next question in front of us is, what causes arthritis? Though we do not have the exact answer, we have a lot of knowledge that what are the precipitating causes. First of all, there has to be a genetic background, a familial background. Let's say someone in the family has arthritis, then other members have an increased risk of having arthritis. It is not necessary that all the others will have, but obviously the risk is increased. And what precipitates the risk? Often it can be smoking. Smoking produces smoke which injures the lung. Sometimes smoke from even the environment, what we call environmental pollution, can come into the lungs and affect the lungs. Then there are various infections, maybe infections of the lungs, but most importantly, infection of the gums. Yes, the gums. That can lead to arthritis. But again, this is not an overnight phenomenon. The infection in the gums can precede the onset of arthritis by years or even decades. So once we have this infection, let's say in the gum or in the lung, or there is damage because of smoke into the lung, then there is activation of the immune system, and the immune system produces antibodies. What are the role of antibodies? Normally, antibodies are protectors which help to protect us from various microbes, bacteria, fungi, etc. But what happens after it is eliminated? After the microbe is eliminated, the antibody should disappear. But what happens if there is some dysregulation in the immune system? These autoantibodies, they go and accumulate in the joints, thus precipitating arthritis. This again can be a long phenomenon, and why this happens only in some persons and not in the others, we are yet to understand. But overall, now we have very good knowledge that what are the risk factors for arthritis. The next question is, what are the signs and symptoms of arthritis? We need to catch arthritis early, and one of the earliest signs of arthritis is involvement of the wrist or the knuckles. If there is pain in the knuckles or in the wrist, especially early in the morning, this may be a very important sign. A lady who is unable to knead her dough while making rotis need to get checked up for her arthritis if she has arthritis. A child who limps may be having arthritis. Children often do not complain of pain, and the first manifestation of arthritis can be a limp. A person can have arthritis of the spine and present with backache. So all cases of backache need to be screened if they have some underlying arthritis, especially if it occurs at a young age in adolescence or 20s or even 30s. So pain which is worse in the morning, pain which improves while working throughout the day, or pain which has very good response to say painkillers may be in fact due to arthritis. Also a very important component is night pain. Night pain is one which wakes you up in the middle of the night. It is not just pain which prevents you from sleeping. So to summarize, today we have seen that arthritis can happen to anyone and anyone. Why? What causes arthritis? There is dysfunction in the immune system which causes the various inflammatory arthritis. What are the complications of arthritis? If not treated, besides deformity and pain, various other organs can be involved, including the kidneys, eyes, skin, etc. And the leading cause of death in untreated arthritis is heart attack and stroke. And the earlier we treat arthritis, the better it is. The more chances of the arthritis ending soon, the better response, as well as to prevent complications. But treatment is not for today. Possibly in one of the upcoming videos we'll talk about prevention and treatment of arthritis. Thank you.